During the evaluation, we come up with a diagnosis, whether it be depression or anxiety, and they're treated differently. So once we figure out what the actual diagnosis is, that guides treatment. So if somebody has a trauma-based disorder like PTSD, then we focus on the trauma first. But before we go into that, I provide a lot of education about how to treat these things, how the process will work, and depending on the person's personality, we adjust that to them. We set up goals when you first come in, and say if it's depression, we'll rate your depression from 0 to 10. 10's bad, 0's good. When you first come in, you may be at around an 8. I'll ask you periodically throughout treatment where you're at from 0 to 10. It's fairly simple. We identify what the depression symptoms are, how bad they are. So if you're an 8 or 9 when you come in and you're a 3, then it's gotten better. That's how we determine. It's hard to rate that because it's subjective, and that's what depression and anxiety are. They're subjective. They're how you feel. So we rate that, and if our goal would be just get your depression to a 3, when you hit a 3, you're done. I try to see I like people to a 0. I want to get them done so they don't have to go anywhere else and they don't need therapy anymore. But it doesn't always get there. It's kind of an imperfect process, and we just have to adjust it based on what the person needs. If it's trauma-based stuff, there's a certain way to do that where we rate the traumatic memories from 0 to 10. 10's bad, 0's good. Try to 0 them all out or get them at least good enough. Usually people report to me that they're just feeling better and they say, I'm feeling good. We could probably cut the sessions back. So we'll go from weekly to bi-weekly. And then when they're feeling even better, we go from bi-weekly to once a month and then booster sessions as needed. But more often than not, people come in, they say thanks, they said it was helpful, and they said they think that they're done. And I say, great. We come up with a plan so they can call me. I have people call in back that have been in therapy with me. They did maybe a 4-month therapy session group, and then they'll call me, and then they'll come back in for a couple more, and then they'll say they're done again, and then they go live their lives. And I think that's a good way to do it because they know the door's always open, that it's not just like you're gone and you're done. If you need something, they send me emails. I've had texts from clients and calls and emails and everything, and I just answer a question and they decide if they want to come back or not. And then we set up with a good aftercare plan so they know what to do when they leave. We're well prepared for it. You start planning for that as soon as they walk in the door. I start planning for how am I going to get them done so they don't need to come anymore. And some people just reach out and just say, I'm still doing good, and that's great. The medication issue is a complicated one. Medications, I have a pretty good knowledge of them. I don't prescribe medications. I refer to a primary care physician or a psychiatrist. They handle the medication side of things. I can give you sort of a general idea of medications, antidepressants, anti-anxiety, and I can talk about them with you for a while, but the doctor is going to decide what medication is best for you. And if we feel after, 6, 7, 8, 9 sessions that maybe the talk therapy isn't getting you there fast enough, then we try the medication route. I can suggest some vitamins and minerals that are good for you. One's vitamin B is really good for anxiety. Fish oil, omega-3 is really good for depression. Eating a balanced diet, sleeping well, nutrition, and just taking care of yourself in general can help with a lot of issues with depression and anxiety. So we'll try a lot of things first, and medication I sort of see as a last route. That if we need to use it, we will. But I tend to try to keep people away from that if I can. But if they need it, they need it, and we do a referral to a doctor, and then they decide what medication is best for them. Some people come in and it depends on the person and the personality. Some people are very open and they're more than happy to tell me pretty much everything. Some people I actually have to slow them down. They start telling me so much. I don't want them to go that far in the first session. Then some people it's sort of like you're pulling it out of them. You ask a question, they'll give a one-word answer. Usually they're a little standoffish because of maybe a bad experience with a different counselor or distrust of mental health people in general or medical people in general. Some of them have had bad experiences with doctors or other providers, so they're feeling me out, and I always tell them I'm always open and honest, and they can ask me any question that they would like, and I always answer questions honestly. So yeah, sometimes it takes a while for people to warm up. Sometimes not very long. Some people walk in and we just have a rapport right off the bat. It depends on the person. Everyone's different. I find that with the older population, I see a fair amount of depression, grief, loss, perhaps their husband or wife passes away. So I do grief and trauma counseling with them. The first step with the older population is to get a good rapport going. And once you get a good rapport, they see I'm younger than them, so I have to earn their respect, which is what I do within the first couple sessions. So then we, again, same routine, just tailor treatment to the older population. We come up with goals specifically, and we work towards those goals. Talking about the problem can solve it. Just in problem solving and working through it, it can reframe or flip the way you view a problem. A lot of issues with depression and anxiety are just brought on by faulty perceptions of themselves and the world. So if somebody always thinks that bad things are always going to happen to them, we deliberately focus on some of the good things that happen to them. So introducing contradictory information to the way they view the world can usually have them see that there's a different way to look at things than the way they've been looking at them. I never had to teach anybody to think more negatively that's come into my office. People go that way sort of all by themselves. So we got to learn to change that negative thinking and install more positive thoughts. But when the talking therapy doesn't work, I have some other techniques too, which would be mindfulness, which is meditation, relaxation, breathing techniques. And also I can do the EMDR if there's trauma-based disorders. So sometimes talking is not the answer. If you have somebody with a really bad PTSD, talking about it in and of itself won't actually solve the problem. You do the EMDR and you reprocess it internally, and then outwardly they start to do better. I think people call me whenever things get to a point where they realize, for whatever reason, that it's kind of out of their control. They want to hear an objective outside person come in. They want to get an outside opinion on things, somebody that has experience with mental health issues, depression, anxiety, trauma, substance abuse. Because they're thinking in their head, something's not right. They can't always put their finger on what's wrong, but they come in and by the time I complete my assessment, it's very obvious to me what the problem is. Then the next step is trying to explain to them, this is how we fix it. And either they want to go through with the process or they don't. So I always say, this is what I think's going on. I'm fairly certain that's what it is, and this is how we'll fix it. And then they decide what to do from there. There's a lot of different therapies. A big one's cognitive behavioral therapy, which I do and I've been doing for a number of years. Another is the EMDR, the eye movement desensitization and reprocessing, which I think is really good for trauma-based therapy. Another competing theory would be trauma-focused cognitive behavioral therapy, which is a little bit different than the traditional CBT, which it focuses more on trauma. The EMDR I feel is good because I number one had it done myself. I was a client for EMDR and it was enormously effective for me. I was skeptical about it when I first got into the training, and then after having it done I realized how effective it was and how much it helped me personally. And then I think, okay, I want to share this with other people. So if you encounter a situation where you feel like you've been traumatized or you're having nightmares or flashbacks or insomnia or anxiety or depression related to a traumatic event, which everybody defines trauma differently. If you're having those symptoms, there's typically something going on. So you have something happen, a car wreck, and 6 months go by and you're still having a tough time getting in the car and turning the keys and starting the car and you're starting to have anxiety, you should get treatment for that. What happens is when a traumatic issue happens, it becomes stuck in, it's called trauma time in your brain, where you just relive that event over and over and over again until you resolve it. What EMDR does is help us resolve that so you can start over and kind of clean out your brain, is the way we look at it. Oh, I get supervision as needed. If I feel like there's a client that comes in and they're dealing with something really, really heavy that maybe I don't have as much experience with, I will seek outside supervision. I pay for that myself. I have supervision on occasion when needed. If there's a client, I have access to resources with Dr. Greenwald and also other higher level trauma clinicians that can be very helpful with supervision. So I have a lot of resources at my disposal if I feel like there's somebody that comes in and it's maybe something that I'm not completely sure as to how to move forward. I will go seek supervision as needed to make sure I can figure it out. And I usually do.